My name's Veronica Judy Cecil. I'm Senior Deputy Commissioner for the Kentucky Department for Medicaid Services. We welcome you this morning to the Medicaid Monthly Virtual Meeting. We are letting folks in from the lobby, and it looks like it's slowed down. So, and as soon as I said that, it started back up again. We'll just give it a few more seconds to allow folks to join us this morning. Well, good morning. If you're joining us for the Medicaid monthly virtual meeting, we're about to start. We were just giving folks an opportunity to come in from the lobby. Okay, let's get started. Next slide, please. So for those just joining, again, my name is Veronica Judy Cecil. I'm Senior Deputy Commissioner for the Kentucky Department for Medicaid Services. We appreciate you taking the time to join us live, or if you're watching this as a recording, for taking the time to go and watch it, so that you can stay informed about what's going on with the Medicaid program. Today, we have another full agenda. We're going to be providing the regular department updates, which includes information about renewals, the Anthem transition, a federal rules update, open enrollment 2025 for the state benefit, the state exchange, the health benefit exchange for qualified health plans, our reentry efforts, and an update on our home and community-based services waivers. Excuse me. Today, we are also very happy to have our sister agency, the Department for Behavioral Health, Intellectual and Developmental Disabilities, here with us today to talk about the 988 and other mental health crisis resources. And we also have our fabulous Dr. Judy Terrio, our Medicaid director, medical director, here to talk about seasonal illnesses. And then our program spotlight this month is going to be our Division of Fiscal Management. So let's get started. Next slide, please. Next slide. So, every month we like to show the current status of renewals and overall enrollment in Medicaid. And as we've discussed previously, we did see the decline come as we came through unwinding from the public health emergency and the restart of renewals. One thing that we're happy to see is sort of a leveling out of enrollment, so that we're not seeing, a lot of disenrollments. We kind of have now settled into sort of the pre-pandemic renewal cadence that we saw, where we had on average 20 to 30,000 drop off and come back on. Just kind of what we kind of call the normal Medicaid churn. I think what's really great, and we'll talk about this a little bit, is we have so many more resources available, lots more communication and outreach, flexibilities that we implemented as part of the unwinding. And so those are the tools that we didn't have available prior to the pandemic that we now have. So we do kind of feel a little more certain that, people going through the renewal process, we're trying to capture as many as we can to ensure that there's no, inappropriate disenrollment or termination of eligibility as a result of somebody going through a renewal. That's what we call our procedural termination. So we've sent out a renewal packet, and the individual did not respond within the time frame and by their renewal dates, and that requires us to have to disenroll the individual. Let's go to the next slide. So I spoke about those flexibilities, and they are out still on our unwinding website, which we'll share in a couple of slides. But we did put a lot into place to help us navigate renewals. They were primarily around trying to help us increase that passive renewal, that what you hear is called ex parte renewal rate, to allow us to appropriately determine somebody eligible passively. We can go out there, we can check all of the data sources that are available to us and actually be able to confirm eligibility that way, meaning the member has to take no action. So a lot of the flexibilities we have in place are allowing us to take advantage of that ability to maximize that passive renewal. And then we have some in place also that for those that have to navigate an active renewal, so they do have to provide information to us before we can determine them eligible to continue coverage. And some of those include automatic extensions. If somebody hasn't responded within, we've sent them a notice and they haven't responded by their renewal date, we can extend them for 1 month for all members and even up to 3 months if they are a 1915C home and community-based waiver member or a long-term care member. So those flexibilities have allowed us to conduct additional outreach to those individuals, ensuring that we're doing all we can to get them to respond so that we can make that redetermination. We did get to process all of those first set of unwinding following of renewals following the public health emergency. So that's been completed. All of those over 1.1 million people went through that renewal process. We've now moved into, as I mentioned before, kind of that regular eligibility and enrollment processing. So that's what we're now seeing people either go through a second renewal because they had their first renewal following the end of the public health emergency, or we have folks that enrolled newly over the past year and are going through a new and first time renewal. As many of you, especially those who work around or within the home and community-based 1915C waivers, those flexibilities were, the vehicle for that were through Appendix K, and we made several of those flexibilities permanent in the waivers that we submitted and that were amended. If you're interested on what those are out on our website as well, explaining what continued and what did not. So very comprehensive flexibility tracker out on our website if you want to learn more about those flexibilities. They get to the non-1915C flexibilities are continuing until June 2025. That includes child renewals, automatic child renewals. So right now we are automatically extending children 12 months when their renewal comes up. They get 12 months continuous coverage. So that means even with a change in circumstance, they will remain covered during that 12 months until their next renewal. We're able to do that through all renewals through June 2025. Starting with July 2025 renewals, children will have to go through a redetermination, but if they're determined eligible, they will continue to receive that 12-month continuous coverage. We do have a lot of reporting that's going on, and those are all out on our website as well. We have a monthly CMS report on the renewals that are processed within the month. And then we have a 90-day updated report that's required. So in that updated report, we report any pending cases that were processed in that 90-day period. We'll get to see a little bit about that. It'll make more sense on the next slide. Next slide, please. So this is what I was talking about. What we're tracking is on the left-hand side are those original CMS monthly reports. They're due the 8th of the month following the month of renewal. So for example, the August report there at the bottom was due on September 8th. The updated report that you see on the right-hand side reports any pending cases that were processed in the 90-day period, and those are due by the 15th of the month following the 90-day period. So we're just taking August, for example, to help you understand what you're looking at here. On the left side was that original processing of renewals. We had 36,136 individuals. We approved 31,823. We had 979 terminations. And then we had 2 that were pending as we crossed over that August 31st renewal date. And so we reported in the updated report on the right-hand side, you see that there aren't any pending left because we processed those 2 cases in that 90-day period. And then we put how the outcome of that renewal happened in the appropriate place. So you'll see that both of those 2 cases we were actually able to approve, and now that gets reflected in the Medicaid approval column. All these reports, again, every single one of these, both the original monthly and the updated, are all out on our website. Next slide, please. Oops, go back one. There we go. So this, we always try to give the most current snapshot of the past 3 months. And of course, we came out of November, and just to share those numbers, that bottom row there, 38,540 individuals went through a renewal. We had 30,194 Medicaid approvals. We had 1,234 terminations. We had 5 cases pending on that last day of the month. These are cases, again, pending is when they've submitted something and the state has not yet processed it. So we do maintain their eligibility until the state is able to make the determination based on the information that was submitted. And then that extended bucket where those flexibilities I discussed, the 1 month or up to 3 months for long-term care or 1915C waiver members, we did extend 7,107 individuals as a result of that extension flexibility. And then on the far right, we are also tracking the 90-day reinstatement period. So one of the other flexibilities available to states right now is that if somebody is able, after they've been terminated and able to come in 90 days after that termination date, they're able to be determined eligible, then we can reinstate them automatically back to that termination date. So that's the information you see here on this slide. Next slide, please. We always like to remind folks there's a lot of information still out and available on our Unwinding website. We have very much focused on how someone can navigate the renewal process, what to do if they're having difficulty, who can they call. We had a lot of trouble with people trying to create a self-service portal account on Connect. And so we've got an ID proofing tip sheet for that. We ask providers to, even though we're now for some members in our 2nd year of renewal processing for them, it's still always great to remind them that that is a requirement and has to happen. So we always appreciate anyone, a provider, an advocate, anybody who interacts with Medicaid members. They might have them come into an office to post that and make sure they understand that, they may be subject to a renewal and they should be keeping their information updated. That's really critically important to us, making sure that you've got an updated address or email or phone number so that we can reach you when we're in the process of sending out a renewal and trying to contact them so that they can respond to that. So these are available to anybody to pull down and copy and to send out or to post as needed. And we always appreciate the effort to help us get that communication out. Next slide, please. So this is our Unwinding website. And as I mentioned, we've got all the reports on there, the flyers and informational bulletins we just looked at. Lots of information still out there and available and updated regularly on our website. Next slide, please. All right, now we're going to switch gears a little bit and provide you some information on Anthem Medicaid transition. Next slide, please. Hopefully, all the folks on the call today remember and are aware that Anthem Medicaid will no longer be a managed care organization effective January 1 of 2025. So we have, since November 1, been working to transition members. Our transition plan included reassigning all of Anthem's members to a new MCO. We did decide to utilize Humana and United Healthcare as the two Medicaid managed care organizations who would equally split the Anthem population. We performed a reassignment back on November 12th, November 10th. And then on November 12th, we sent out a reassignment notice to all members who at that time was still with Anthem and was auto reassigned to either Humana or United Healthcare. Next slide, please. We also removed the option to choose Anthem back on November 9th. So after that date, new members could not be assigned to Anthem, and current members were not able to choose Anthem. We do want to make sure people understand that anybody who might not have been picked up in that November 10th reassignment, we will ensure on December 31st, any remaining Anthem members will also be auto-assigned. Really important to know that a member always has the option to choose their MCO. So even though we are reassigning members to either Humana or United, they can go in and choose their own MCO. And we're seeing that. So there are 3 other MCOs that are available to members. And we're seeing that, members are taking the time to make that change if they feel like there's an MCO that's better for them. So just know that that member choice will override any automatic reassignment. But we have been meeting regularly with all 3 MCOs, Anthem, Humana, and United, making sure that there's a smooth transition and a nice warm handoff, especially for members that really kind of need that extra help. So any member that's in care management with Anthem, we've identified if there are any pregnant members, they're out of state, who are in residential or inpatient care, or any member that has a chronic disease with ongoing treatment. All of those members have been identified, and we've been working with the MCOs to make sure that there is outreach by the new MCO to ensure a smooth transition of their care. Next slide, please. So lots of communications on this. We do have a dedicated website on the Anthem transition, and you see there it's Kentucky Medicaid Anthem MCO transition. We have frequently asked questions document that we're keeping updated as new information becomes available, or that if we get a question and we feel like it's very helpful for lots of people to know that information, we've been keeping that updated. There is a dedicated phone number for Anthem members. This is only for Anthem members. You see on there, it's 1-833-501-9930. So we encourage Anthem members, if they have any questions, if they're having trouble navigating the change, to please call. We want to be supportive and helpful to members going through this change. They can also call Anthem about any services prior to, on or before December 31st, or they can call their new MCO if they have any questions about any services starting January 1, 2025 going on. So if you're worried about if you've got a prior authorization, if you've got, you're in treatment that's going to cross over that date, I definitely recommend reaching out, especially providers, if you have questions, both providers and members, to reach out. We're happy to try to help people navigate the change. Next slide, please. And now we're switching gears again very quickly. So we have in one of our previous forums, we discussed all of the new federal final rules that are requiring changes to the Medicaid program. There's 9 in total, and they all have various compliance dates and implementation dates, and they go out as far as 2030. But most are kind of around 2027, some 2026. But so we're focusing on those different rules, and we're providing update on rules as those compliance dates approach. And we're obviously dealing with the ones that are the earliest to us. One of those is the final rule that makes changes to the Medicaid Advisory Committee and also creates a new Beneficiary Advisory Council. We just completed 2 virtual forums, one on Monday and one yesterday, on these new requirements and to solicit feedback from Kentuckians about what they want to see as far as changes to the current Medicaid Advisory Committee, or what it looks like to create that new Beneficiary Advisory Council. So we've got a survey that we've created to try to pull in that feedback. We are so here's the QR code. We are posting on our webpage today a recording of those 2 forums, the PowerPoint presentation that was presented at both forums, and as well as the link to the survey. So you don't have to, if you're having trouble with your phone, or you don't have the phone to be able to go to the QR code, there will be a link on our website. All of that is being updated this morning, and hopefully will go live very soon today. We also will be sending that out through various distribution lists. So if you're signed up for the Gov Delivery email distribution, then you'll definitely get that later today. We really hope to get a lot of feedback from the various organizations and groups and members that interact with the MAC and that would interact with the Beneficiary Advisory Council. So we hope that people will take the time to provide that feedback to us. So we really want to hear from everyone on that. And this requirement goes into effect on July 9th of 2025. So we're really pressed on time to make sure that we're in compliance. Okay, next slide, please. All right. And I see a question I'll take real quick, and that is, has there been any communication about the Anthem transition to dual eligible folks who will have their DSNP, DSNP, that's dual eligible special needs plan, affected by Anthem's exit? And I appreciate that question, Priscilla. We are right now waiting for more information from the Centers for Medicare and Medicaid Services on the timeline for that. And so it's status quo right now, but we should be in the very near future, like potentially in the next week, be able to provide more information about that transition. I know that it's really difficult to not know what's happening, but we can't share information until we have confirmation from CMS on what those requirements are going to be. As soon as we have the information, the definite information, we will start doing communications. Anthem is required to send a notice to beneficiaries, so we'll have information about what date that will be released, and then what the next step are for those members. We definitely plan to notify connectors and insurance agents about the information and the dates once that's been confirmed. All right, so I'm going to turn it now over to David Veary to give us our update on open enrollment.
Morning, folks. The next slide, please. So open enrollment for qualified health plans goes from November 1st until January 15th, technically 1 o'clock in the morning on January 16th statewide to accommodate the central time zone. It began November 1st and has been raging on. We are halfway through, and there is still time. So if people are out there and they do not have coverage through an employer, they don't have Medicaid or Medicare or TRICARE or something like that, we are still an option, and now is the time to enroll. That December 15th deadline was for January 1 coverage was actually extended by 3 days on the federal exchange, and we used our flexibilities at the state rate marketplace to also extend that deadline. So we were enrolling people for January 1 coverage up through the middle of the night last night, and I am pleased to announce that we enrolled 1,000 people yesterday alone. So I'm glad that we were able to do that extension, but there's still time to enroll for next year. Next slide. There are more choices this year. We have new issuers. The application process itself is improved and more streamlined, cutting down the time it takes to fill out an application. We're constantly improving that process and working with people to get in touch with the connector, get in touch with the licensed insurance agent, contact the contact center, work with us. But to make it easier for people to apply, there are more issuers that are offering not only more plans, but different kinds of plans. We have some plans that offer the 4 first visits to a physician are free before the deductible. We have others that specialize in diabetes care, some that specialize in heart care, and more plans are compatible with a HSA, a health savings plan, to help people leverage that financial engine to make it more affordable. We also have a new dental carrier that's been added, and they're statewide as well. And next slide. Oh, the big number. Yes, we actually are at 92,000 today, but over 90,000 people have signed up already for a qualified health plan for 2025. This is a substantial growth, not only from last year to this year, but in the history of the exchange. We are well on pace for this to be our second highest ever, and we already have found more people enrolling than have enrolled in many years, especially when we were on the federal exchange through the pandemic and all those darker times when the pandemic was with us. This is kind of like a stabilization that the deputy commissioner was talking about, that, you know, as people have left the Medicaid space and that's kind of stabilized, people are returned to work, which is exciting. Many of them have coverage through there. But for people who are in that transition, maybe they're between jobs, maybe they're in the gig economy or self-employed, they're finding a home here on the exchange. So it's exciting to get everybody the health coverage that is most appropriate to them. Next slide. And we've been, hopefully you've seen us or seen about us on all kinds of different channels, through marketing, over the air, over the radio, through social media. We need your help too. So anything you can do to get the word out. There's still time to enroll. If people miss open enrollment, they will have to wait for a special enrollment. That's a qualifying life event. And we're excited to also remind people that beginning January 1st next year, being pregnant will be a qualifying life event to sign up through Connect for a QHP for those persons who might not qualify for pregnancy Medicaid. But now is the time, so thank you all for getting the word out, and again, asking for your help. And if anyone does need to enroll or have any questions, connect.ky.gov. Up at the top of the screen, there's a Get Local Help that will help persons find a connector or an agent, whichever they choose, or they can call us at the number there below. And again, thank you to all. We are not resting on our laurels. We're only halfway through open enrollment. There are still people who need health insurance out there, and we're doing everything we can. Thank you all.
Thanks, David. Good morning again, Angela Sparrow with the Behavioral Health Team in the Department for Medicaid Services. So we want to provide some updates, again, reentry updates, but also some broader updates around our 1115 demonstration initiatives within Medicaid. Next slide, please. So again, we are pleased and excited to be able to say that Kentucky did receive approval and extension for our overall Team Kentucky 1115s. So again, we see that there are several 1115 demonstrations that fall under Team Kentucky. There are several initiatives that fall under the broader Team Kentucky. So with this approval that is approved through December 31st of 2029, here you see there is the out-of-state former foster care youth, which again, this was one of the original components under Team Kentucky that was approved first back in 2018. And this again allows for coverage of former foster care youth that were in foster care in another state, had moved to Kentucky, and again would be eligible for Medicaid under this group. It also, again, included an extension for our substance use disorder 1115 demonstration, which was first approved in 2018 and then again implemented in 2019. So this expands coverage for SUD residential treatment services, and this allows us to continue that expansion of services. We also, again, have the reentry 1115, which was recently approved first approved in July of this year. We did receive that full approval again to extend that out to December 31st of 2029. So this allows for Medicaid coverage, again, for certain services to justice-involved individuals in our state prisons and our youth development centers. And this is to ensure that there's that continuity of care and healthcare coverage, both again, pre and post release as that individual returns to the community. Again, that we're addressing those medical, behavioral health, and those health related social needs upon release, and working with our correctional justice partners to do so, our community providers and our healthcare plans to coordinate that. We also did receive an approval for our serious mental illness SMI 1115 demonstration, very similar to the SUD 1115. This expands coverage for our inpatient treatment for adults with serious mental illness. And we have, again, a new demonstration under the health-related social needs, so that HRSN 1115 opportunity. We were approved for a recuperative care pilot. So this again allows the state the authority to reimburse for recuperative care, also known as medical services. And so this is going to be for adult beneficiaries who are homeless or at risk of homelessness that require additional medical support and care coordination following a hospital stay. It can also be even for a pre-planned procedure as well. And then again, with a new approval, this is for Recovery Resident Support Services, or RRSS, and this is going to fall under SUD. So this again is for individuals with SUD that are transitioning into the community from our reentry population 1115, as well as individuals that are participating in the Kentucky Behavioral Health Conditional Dismissal Program. This allows, again, the authority to reimburse up to 90 days for a recovery resident support service. So again, this is not reimbursing for recovery housing in the housing space, but this does again allow us to develop a service that can be provided by recovery residences that meet the standards under the approval and the criteria, and then again be able to provide those needed supports in the community. Next slide, please. Also want to touch on an additional project, again, if you will, or initiative that is quickly approaching. So the new provisions for Medicaid services for placed youth. And so again, with the 2023 Consolidations Appropriations Act, or CAA, there was a mandatory section included within that, Section 5121, that amends the existing laws that are limiting, or that have limited Medicaid and CHIP coverage, for incarcerated individuals and youth. So with this, this new provision, which is to take effect January 1st of 2025, so very quickly approaching, this is for adjudicated juveniles. So there's been a disposition, there's been a sentencing, there's been a determination. So for adjudicated juveniles that are eligible under 21 years of age, or again, between the ages of 18 and 26 that fall in our former foster care youth group. So this is the population that would be eligible for services, but it is again more targeted, not full state plan covered services, but targeted services to include the screening and diagnostic services 30 days prior to release. So that includes, again, medical, behavioral health, even dental hearing services. So those, again, can be reimbursable if provided within that time period as a Medicaid covered service for this population, as well as targeted case management services 30 days pre-release and at least minimal 30 days post-release. So really, again, addressing what are the behavioral health, medical, and those health-related social needs for this youth and population. So when we think about the age range in the eligible youth, that can include a variety of settings in Kentucky. So our youth development centers, our youth detention centers, our state prisons, and our local jails. Just want to note again that Medicaid, again, in Kentucky has applied for a planning grant to support this implementation. CMS, Centers for Medicare and Medicaid Services, has made opportunities for state to be able to support this implementation. It again is over a 4-year period, and we hope to hear in the first quarter of the year about that award notification. But this, again, the planning grant will also help support our correctional partners in implementing the services as well. And so again, this would just not be for Medicaid. Next slide, please. Here, just want to give a little timeline. So with the approvals, with CAA, we can see again, there will be a great deal of effort to implement all of the approvals that we received under Team Kentucky and CAA through 2025. So going back to the reentry demonstration, we've talked historically again and previously about some of the requirements of the state to implement this. So we still have some deliverables that are due to CMS the end of the year, such as our reinvestment plan and evaluation design. Again, an independent evaluator does evaluate the Team Kentucky projects, the 1115 opportunities, and report to CMS. So that is due the end of the year. And then again, the Section 5121 becomes effective. We will be implementing CAA 5121 1/1 of 2025. But again, we will work, you can see, through 2025 to continue ongoing efforts in planning and onboarding facilities becoming into full compliance with CAA requirements. We are initially starting with our state prisons, piloting again with our youth development centers, and we'll again continue to build that relationship and onboard with our jails to again meet the CAA requirements throughout 2025. And then you can see here there's some deliverables that are due to CMS for Team Kentucky and for those additional components: SMI, recuperative care, and the recovery resident support services. So those new components under Team Kentucky, again, have implementation plans that are due, monitoring protocols, and again, those evaluation designs. So that will be into the first and second quarter of 2025. And then again, we will continue the reentry planning. There are readiness, again, assessments, system changes, so forth, that will occur through summer of 2025 with an implementation, full implementation of the reentry 1115 October 1st of 2025. So those additional components under Team Kentucky, the SMI recuperative care, those go live dates are to be determined. So again, we'll hopefully be able to provide those updates soon. Next slide.
Thanks, Angela. My name is Alicia Clark, and I am here to provide the waiver updates for long-term services and supports. And if you'll go to the next slide. And so I know that you all, for the ones that have been on this meeting before, you've seen this slide. We do have a little bit added at the bottom, but the most exciting thing that I want to tell everybody is all 6 of our waivers were recently approved by CMS. We got those approvals a few days ago, which is super exciting. So we have lots and lots of changes taking effect 1/1/2025. A short memo did go out yesterday to all of our listservs. So I encourage you, if you are not receiving information about waivers and you want to, please submit an email to our Medicaid public comment box. And I can put that in the chat for you all in just a few minutes. So that you can get all the information that we send out. That memo did include a link to the waiver rates that will be effective January the 1st, and then to links to the approved waiver applications. We were tasked with getting all of the system updates in and ready to go as of 1/1/2025. So there are 2 systems that this is going to affect. That's going to be our MWMA, where our prior authorizations are put into from our case managers, and the MMIS, or the claims reimbursement system. Like I said, the team is working around the clock on getting all these changes in there and ready to go. That is going to require some changes for some services, and we are working on a more detailed letter on changes that will need to occur. So that has been sent for final approval. The hope is to get that out tomorrow, but at the latest on Monday. And again, those changes won't go in effect until 1/1/2025. So from that time forward is when changes will be able to be made. But that all the information is in that detailed letter that we're working on, and we will get that out as soon as we get approval. But we're super excited. The rates, we've spent a lot of time on the rate study and getting those put in, and all of these amendments to CMS. So it's super exciting that we got that approval. So we've been working with them day in and day out to get that done. And I will turn it back over to my team.
All right. Well, good morning, everyone. Thank you for this opportunity. My name is Angela Roberts, and I'm within the Division of Mental Health, housed within the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And I'm here to talk about something for which I'm very passionate and love to share the information about. So next slide, please. 988. Hopefully everyone has heard of 988, but just a quick background is that the Substance Abuse and Mental Health Services Administration, I believe I got that right, SAMHSA, has implemented the National Suicide Prevention Lifeline since around 2005. There was a great need to enhance services and expand it to make it more easily accessible. So in July of 2022, the 988 Suicide and Crisis Lifeline launched. In its first 2 years, as you can see on the slide, there have been more than 10 million calls, chats, and texts from individuals experiencing a crisis. Now, as they were building this out, the intent was to have 3 pillars to build crisis continuum up on. The first one is someone to talk to, the second one is someone to respond, and the third one is a safe place to go. So next slide, please. What we're going to talk about is the someone to talk to. Next slide. With the change to the 988 Suicide and Crisis Lifeline, which has been shortened, most people refer to it as the 988 Lifeline now, there is voice and choice for the individual in crisis. And in essence, anyone can call or text 988 and reach a trained, caring, compassionate crisis counselor. Now, the voice and choice comes in that anyone military connected, whether they are active duty or retired, or a family member of a veteran, can contact 988 and be connected to the Veterans Crisis Line. In recent years, they've added the Spanish subnetwork for those who predominantly speak Spanish or prefer to speak in their native tongue. And then they, in 2023, added the LGBTQ+ for youth and young adults up to age 25. So these are options that they can have the ability to talk to someone with that lived experience. There's also the text and chat for the Spanish and LGBTQ sub networks as well. So for those that prefer to communicate through that modality. And then again, we've also recently added the deaf and hard of hearing so that there is video phone service for those who prefer to communicate or are best able to communicate with trained crisis counselors in ASL. Next slide, please. So a quick overview for people that aren't aware, because there have been changes with this. Anyone who calls 988 from a landline will be connected based on their area code and phone number. So again, it's more if you're in 502, you're going to be connected to the center that's assigned to that area, 606, 259, and so on and so on. As far as the cell phones, geo-routing was implemented this year to allow for connection to the most local crisis center. As we know, many people with cell phone numbers, they may move and they keep their number from where they originally received it. So now it doesn't matter what phone number you have. If you're on one of the major carriers that have implemented geo-routing and you're in crisis, you will be routed to the center most close to you, which provides that access to the local resources that are available. Next slide. For those that prefer to text, it's real easy. You text 988 on your mobile phone and you're connected to a state center that's available at the time. But if they're not, then it can roll to a national backup center. Next slide. And it's the same thing with the chat, except you do this online through the link that's available. And you can also access it on the 988 Lifeline website. A short survey is completed to make sure that you're routed to the appropriate place and kind of done some screening. And again, it's the same process. It's connected to a local center, but if one's not available, it does go to a national backup center. Next slide. What we found in some of the major changes with 988 is that it is no longer just the suicide prevention lifeline. As the name says, it is the 988 Suicide and Crisis Lifeline, which means anyone can call about whatever crisis they're experiencing. This is data that we collected from our centers that take the calls for October. This was the first month that suicidality was the top reason. Prior to October, suicidality was typically the third or fourth reason, right behind friend and family issues and mood issues. So as you can see, there are a host of reasons why people reach out to 988. Our intent with this is, and the goal that we have in Kentucky and across the nation, is that people reach out before the crisis escalates. We want to be able to provide those services and connect them to resources to mitigate the impact of whatever crisis they're going through. Next slide, please. So we're working on transforming crisis care, and this is occurring across the nation with the more than 200 plus centers because 988 is a network. By having a network, we can ensure that we have a system that people are going to reach someone trained to de-escalate the crisis, to provide the resources and get them the help they need in a much faster manner. Next slide. What we're trying to do across the state is inform people that 911 is not always the best option for someone experiencing a behavioral health crisis. So we like to educate and work with our partners to say, if you're having a medical emergency, if you're having something that you need law enforcement or EMS or fire, you call 911. If someone's having a mental health crisis, whether it's anxiety or depression, or maybe they're having a substance use crisis, they can call 988 instead. And the wonderful thing about this is that we are able to connect them to resources through the network, regardless of who they are. One additional change with it is that it doesn't have to be the person in crisis. If you know someone that's experiencing a mental health or substance use crisis, you can call on their behalf to get those resources. So it's building that system to connect people in crisis to the resources and the services that they need. Next slide, please. Through the 988 system, we are working to transform the crisis response in many ways. One of them is in March, we launched the mental health treatment locator through the findhelpnow.org website. We worked with our partners at Kiprick through the University of Kentucky to provide this service for anyone in Kentucky that's seeking any type of mental health treatment. Providers are able to update their information and list it on the website with the various services that they provide, if there's any particular insurance. And there are a lot of filters to help individuals search for specific type treatment. In addition to the mental health, as you can see, there's substance use disorder treatment, recovery housing, and naloxone locators included in this. Next slide, please. We're also working with our emergency services agencies across the state because we hear so often that, especially with law enforcement, that they are involved in many 202As and they want to be able to help these individuals. And the process is not always expedient, and they're sometimes end up staying with someone or having to transport them out. So we want to make sure people are aware that 988 is available. And our goal with this and within Kentucky is to help reduce the number of 202As by providing that entry point into the crisis continuum. So we've created a couple different materials that we have been distributing. One is kind of a guide to help people understand when they can call 988 and when they should really call 911. The other is the little tear sheets that you see there that we're putting in the hands of emergency services around the state. And these are for law enforcement, EMS, fire departments, coroners, any agency that encounters someone experiencing a behavioral health crisis that doesn't need to go to the hospital or doesn't need law enforcement involvement. They can give these to them and give them a resource to connect to the trained crisis counselors. That's what the front of the tear sheets say. On the back side, we want to hear from them. So we've implemented our feedback survey so that we can continually improve in our services across the states. Now we have in Kentucky 14 community mental health centers that house our 988 centers. So we have a wide variety of services available in all 120 counties. Each community mental health center is the behavioral health safety network for their region, and they are best suited to provide those local resources. And just this month, we have been able to ensure we have 100% backup coverage for all 120 counties, increasing the likelihood that anyone in Kentucky will reach a Kentucky Center when they're in the midst of a crisis. Next slide, please. There's our feedback survey that we encourage everyone to share. And we ask for anyone to include this on their social medias or, in their emails, because we really do want to hear from those using the service so that we can continue to improve the service that we provide. Next slide. These are just some ways that you can help. We're always looking for individuals to join any of our work groups or our coalitions. We're happy to do presentations to further educate because there are so many components to 988 that I would not have enough time today to touch on it. So I'm giving you a very high level of what we're doing in Kentucky and across the nation as far as the network goes. Next slide. So there's my contact info. If anybody has any questions, please feel free to reach out to me. We're happy to provide materials or resources, or if you'd like to schedule a presentation, whatever it may be, 988, please feel free to reach out. So thank you very much.
Well, I'm Dr. Judy Terrio, and I'm here to talk about seasonal illness. Next slide, please. So this is the season for fevers, coughs, stuffy nose or runny nose, headaches, sneezing, body aches, all that goes along with the holidays and winter time. Next slide. We call this viral respiratory season. So it's, fall, winter, early spring. That's when viruses that cause respiratory illnesses circulate more in the community. It's also when people, because it's cold outside, stay inside more. And so the more you're inside in a closed-in space with people, the more easily viruses can spread. So last year, the CDC reported 200 pediatric deaths from the flu during this season. Also, for flu deaths overall, we had about 100,000 with almost 1 million people being hospitalized for the flu. So even though viral respiratory season, you might just get a cold, it might last a couple of weeks, or just stuffy nose, it can be deadly. And there are some things that we can do to prevent it. Next slide. When I think of seasonal illnesses, most of the time, I'm thinking of viruses, and you can see those on the left side of the slide. But there is one in particular that I'd like to mention, and that's whooping cough, and that's a bacterial disease. And the reason I divide these up is viruses, you can take an antiviral to help treat them, but pretty much antibiotics don't work on them. But antibiotics will work on whooping cough. Next slide. The number one thing you can do to fight these horrible illnesses during the season is to get immunized. It's the best way to protect yourself. It might not stop you completely from getting the disease, but if you get it, it's going to lessen your symptoms. The CDC actually recommends a flu vaccine and a COVID vaccine for everyone 6 months and older, so even those little babies. They also recommend a pertussis vaccination for pregnant people and adults who are around infants, and it's also part of routine childhood immunizations because it spreads very easily. A new one has come about, which is the RSV vaccine, or respiratory syncytial virus vaccine. This is RSV season as well. The CDC recommends babies, pregnant people, and then the older people, 60 to 74, with increased risk, or 75 and older for everybody. And these vaccines will help protect you against all of these diseases that we see this time of year. Next slide. The other thing we can do to prevent, in addition to the vaccinations, and we learned these things in COVID, avoid close contact with people who are sick. And if you are sick, stay isolated. Wash your hands often with soap and water. And if you don't have that available, go ahead and use those alcohol-based hand sanitizers. Also, avoid touching your eyes and nose and mouth because germs spread that way, you're actually putting them into your body that way. Cover your coughs and sneezes, and again, cover with your elbow. Don't cover with your mouth, with your hand, because if I sneezed into my hand and then was in the grocery store and reached over and picked up a can of soup, put it back down, then the next person that picks up that can of soup is going to get my germs. So remember, into your elbow, not your hands. Also, if you're at home, try and clean surfaces regularly with antiseptic wipes. That will help keep the germ burden down. And then if you can improve air quality by bringing in the outside air, or by gathering outside if it's not too cold. Next slide. And if you're sick, very important, limit contact with others as much as possible because you don't want to make them sick too. If you have the flu, the CDC recommends that people stay home for at least 24 hours after your symptoms are getting better, and after you haven't had a fever. Next slide. Pertussis is a little different. This is the one that we treat with antibiotics. It's also called whooping cough or the 100-day cough. That means if you get it, you might cough for 3 months. They did a study that showed of adults with a prolonged cough that 25% of them had pertussis. Now, this is just like anything else, any other cold that you get. You're going to have a low-grade fever, running nose, coughing. With adults, it's not too bad. It just lasts a long time. The problem is if you are around people that aren't immunized, such as infants, you can give pertussis to the infants, and that could mean hospitalization and death. So it's very important to protect those little ones, and again, the older people from pertussis by making sure you're immunized. Next slide. Treatment is pretty simple. You want to get rest and fluids and, control fevers with medications if you can. For the viruses we talked about, you can get medications, antiviral medications, but you really have to start those early on in the course of the illness for them to be effective. And you can only get those by prescription. For pertussis, you can use an antibiotic to treat that. It will decrease the symptoms and will stop the spread, again, if you've started it early on. And this is the only one that the CDC recommends prophylaxis for. So if I was exposed to somebody with pertussis and I'm not sick, they would suggest that I get the antibiotics just in case to make sure I don't get it because it's that contagious. Next slide. So changing course a little bit, I wanted to tell you about a new initiative called Our Healthy Kentucky Home. And this is for the entire state, and I'm very excited about it. It's to get us in shape as a whole community. It's very simple to do. All you have to do is eat 2 servings of fruits or vegetables a day, just 2, should be doable. Exercise at least 30 minutes 3 times a week. And I don't mean go off and run on a treadmill or do something crazy like that. All you have to do is walk. Walk 30 minutes a day for 3 times a week. That's it. That will do wonders for your blood sugar. And also stay connected. Stay involved in your community. Do groups and projects. These 3 things will do more for our health in Kentucky than anything else. So I challenge you guys to do that. If you want more information, you can go to ourhealthykentuckyhome.ky.gov and learn more about the initiative that was just started last month. And then every month, we're going to have a focus on one aspect of being healthy. And this month is heart disease. So next slide. So according to the CDC, again, 600,000 people nationwide die from heart disease every year. And heart disease is one of the leading causes of death in our state, in Kentucky. So we want to bring awareness up to that for everyone for this month. And then again, the thing you can do to stay healthy is 2 fruits and vegetables a day, exercising, which could be walking 3 times a week just for 30 minutes, and then staying connected. And that's all you have to do. Next slide. And I just wanted to tell everybody to please stay healthy and happy this holiday season. It's going to be a great one. And we'll see you in the next year. Thank you.
Thank you, Dr. Terrio. We always appreciate that advice. And because we are running over, we have decided that we're going to push the program spotlight to next month's forum. There's been a lot of great information today. We hope that it has been helpful. We appreciate all the questions in the chat, and I hope that we've been able to address them. As always, it's wonderful to see folks taking time out of their very busy day to be with us today. So thank you. We wish everyone a very happy holiday, safe and healthy holiday, and we'll see you in the new year. Thank you so much.